Howdy folks, Kevin Shakin here, and today on this video, I'm going through Medicare by the numbers. Let's touch on all the numbers you need to know for 2023. We're going to be talking about premiums and out-of-pocket expenses. Starting with Part A, which of course is your inpatient care, the premium for most people is zero. If you have worked 40 quarters or 10 years, then you've paid taxes into this program and you will owe zero for Part A, just like if you qualify for Social Security benefits. If that does not include you, you can make payments of a premium for Part A, but it's pretty pricey. You're going to pay $278 or up to $506 per month for Part A. The out-of-pocket expenses for Medicare Part A in 2023, you have a deductible of $1,600. That is not annual, by the way. That is per benefit period, which is essentially about a 60-day window. So you could pay that multiple times per year for a hospitalization or Part A covered service. The co-payments in the hospital, you will pay no additional co-pays for the first 60 days, but days 61 through 90, you're going to pay about $400 a day, and day 91 plus paying $800 a day. Also, for a skilled nursing stay, the first 20 days are covered, but 21 through 100, you will start paying $200 per day. Now, Medicare Part B. This is your medical, your outpatient coverage. $164.90 is the premium in the Part B premium in 2023. That's the base premium. There is an income adjustment. It's called IRMA, the income related monthly adjustment amount. If you are a higher income earner, then you might pay more than $164.90. It's also possible if you're on Medicaid that you may pay little to nothing for Part B, but $164.90 is the base rate this year. Your out-of-pocket expenses, there's a deductible. It's $226 per year. It's a small amount. It's an annual deductible that does not repeat. It is $226 for the calendar year. However, you have a 20% coinsurance out of your pocket for anything after that deductible. There is no max out of pocket on that, by the way, which is obviously why we talk about supplements and other ways to protect yourself. 20% coinsurance after deductible on Part B. Part C, which is Medicare Advantage, the 2023 national premium average is $18, although many of these companies will offer those plans at zero. And you say, Kevin, how can somebody pay zero for health insurance? Well, the insurance company has taken on full responsibility of your Medicare. So the government is wiping their hands clean of that. They pass it to the insurance company and pay them a premium every month to manage your care. You're still paying the government the $164.90 for Part B, but you may not have to pay anything for Part C. You do need to have Parts A and B, or you cannot get Part C. And there is IRMA, the income adjustment, which does apply still to Part B. And since your Medicare Part C plan likely has Part D, which is prescription coverage, the income adjustment applies there as well. The premium will be payable to the plan provider if there is a premium. Your out-of-pocket expenses. Now, this can vary quite a bit. There's a maximum out-of-pocket for in-network care that Medicare sets every year. It's $8,300 in 2023. It's even higher than that if you have a PPO where you can go out of network and you're using both in and out of network services. But $8,300, although many plans will choose to have a max that is lower than that, really all depends where you live as well to see how low that number can get. And then you're going to pay co-pays and co-insurance for most services. So things like preventive services, primary care, oftentimes you'll pay zero, but then you'll pay a co-pay for most other outpatient services, some inpatient services. It could be a per day co-pay at the hospital. It could be a per occurrence co-pay for a surgery or doctor's visit. It varies by plan, by plan to plan. The co-insurance for services, you may also face some co-insurance, like 20% on things like durable medical equipment or outpatient cancer treatment like chemotherapy or radiation. That 20% is still there, but you do have a max out of pocket, so at least there's a ceiling on those costs. Now, Part D, your premiums are going to vary by the plan. Okay, the national average on Part D premium in 2023 is about $32, but you might pay 10 or less, you might pay 100 or more, or anywhere in between. It really depends on your prescription needs. Part D, when it's a standalone, you're going to have your own premium. And IRMA, the income adjustment, also applies. So if your premium is $32, like the national average, but then you also have an income over the threshold, you might pay an additional amount to the government for that income adjustment. Your out-of-pocket expenses, there's a deductible. So in 2023, that deductible is $505. You may pay that for certain drugs. You may not for others. It depends on your drugs and your plan. The co-pays and co-insurance vary greatly by the prescription and the plan. So it's based on the drug tiers 1 through 6, and what tier each drug is on each plan's formulary. So that is not the same from company to company, plan to plan. When you reach certain thresholds, you're going to go into what's called the coverage gap, or what was referred to as the donut hole, where you pay 25% co-insurance. And then if you even reach the catastrophic coverage phase, you might pay a 5% co-insurance or a small premium, depending on which one is more. There is no maximum out-of-pocket with Part D, and that's a scary thing about prescription drug coverage. That is supposed to be coming in 2025, so we'll stay tuned on that. But right now, there's no ceiling. And finally, on Medigap premiums, these are going to vary wildly. So there's not a number we can really put out, because they're based on your location, your gender, the plan you choose, your age, whether you use tobacco or not. Maybe you have a household discount available based on a spouse or partner or family member in the home, whether they're insured by that plan or not. So there are all sorts of things that factor into this. These plans were standardized, however, in 2011. So Plan G or Plan N, from one company is the same as Plan G or Plan N at the next company when it comes to their medical benefits. So it's very easy to compare medical benefits on Medicare supplements or Medigap plans. Your out-of-pocket expenses also vary from plan to plan. So you're going to pay your monthly premium to the insurance company, and then you're going to have a Part B deductible. It's $226. Anybody who's new to Medicare moving forward, unless you were born before 1955, then you're not eligible for plans that have no deductible. So Plan G, for instance, has a deductible, which is the Part B deductible, $226. Okay, you're going to pay that $226 really on any other plan as well. There are also high deductible options. The high deductible option with the Part B deductible goes up to $2,700 this year, and then you'll basically pay your 20% up to that deductible, and then the plan pays after that. So there are high deductible options as well. All depends on how much exposure you want to have and what your utilization is. As I mentioned, Plan F and Plan C, they're no longer available if you were born from 1955 on. Those plans are the ones that may cover the Part B deductible. But what we found in terms of economic benefit, you're actually going to get more out of Plan G when you compare total premiums and the benefit you're losing. That's the only difference between those two plans. Now, income adjustment. So that started for Part B in 2006. They added it to Part D in 2011. It was designed to stabilize Parts B and D. It only impacts about 8% of individuals, but those of you that pay it will certainly feel it. And it is a 2-year look back. So Medicare, if you're applying in 2023, Medicare looks at your modified adjusted gross income in 2021. It's indexed at $97,000 of income for an individual, or $194,000 for a household. By the way, this can be appealed if you have retired or are retiring and your income is expected to drop, as it will for most when you retire. Then you can appeal that. We don't have to wait 2 years for them to look back and then finally correct your income adjustment. So the total premium with the IRMA, the total Medicare Part B premium is actually $659.60. Okay, but most people are paying 25% of that, which is $164.90. Based on your IRMA bracket, if you're over those index thresholds, you'll start paying a higher percentage, 35%, 50%, 65%, 80%, all the way up to 85% of the $659.60. Part D works similarly. It's based on the standard premium of $32.06 in 2023, where you're paying 25%, 35%, 50%, and so on. That's the additional amounts you'll pay on your Part D. So there are 5 different tiers of the income adjustment once you reach that indexed amount. So we're not going to, necessarily, maybe we can put the chart up here for you, but there are 5 different ranges of income, and then, 5 different amounts that is going to be added to your Part B base premium and the Part D surcharge. By the way, just so you at least get these numbers, The Part B maximum, this is base plus the IRMA, is $560.50 per month, and the Part D maximum surcharge is $76.40. So for the highest income earners, you're paying $560.50 for B, $76.40 for D on top of your plan premium, and then whatever you're paying for Medicare supplement and things like dental, vision, hearing. Again, you can appeal IRMA for work stoppages, work reductions, divorce, death of a spouse. Those are the major things that typically happen. Obviously, we help through that stuff. You submit an SSA 44 within 60 days of enrollment to appeal that income adjustment if you feel it is not actually applicable in your situation. So it's hard to say where Medicare is going. At the end of the day, and prices will continue to increase. So I would anticipate each year seeing Part B premium and deductible increases. Hopefully those are not too radical. Obviously we can't guess it all right, but certainly you should anticipate some increases as things do, of course, increase in cost over time. There'll be 80 million Medicare enrollees by 2030. Okay. 26 million right now are on Medicare Advantage. So that's about half or almost half. And in 2024, another important number that's coming up is $2,000 cap on Part D out of pocket. Actually, I believe that's 2025. Apologies. There'll be a max out of pocket of $2,000 for 2025 on Part D. But again, let's wait and see how that all pans out. We know that things don't always work out as we hope they will, and someone's got to pay for it. So that's Medicare by the numbers. If we can be of any service to you and have any questions about what you're going to pay, what your costs will be, reach out. That's what we're here for. Thank you so much for watching.